Do you know what a vaginal yeast infection is, or what are its common symptoms? If you're unsure, you're not alone. A vaginal yeast infection, also known as vaginal candidiasis, vulvovaginal candidiasis, or candidal vaginitis, is an overgrowth of fungus in the vagina that can cause symptoms like itchiness, soreness, and discharge. It's actually the second most common type of vaginal infection after bacterial infections. Each year, approximately 1.4 million people seek outpatient treatment for this condition. But here's some good news. Symptoms typically resolve after a few days of starting medication. However, recurring episodes might require a longer treatment duration. Around 5 to 9% of individuals experience 4 or more infections within a year. While vaginal yeast infections can cause discomfort, they are fairly easy to diagnose and treat. We'll discuss this in more detail further on. So, what are some of the common symptoms of a vaginal yeast infection? You might experience itching and soreness around the vulva or vagina. Discharge is another common symptom, but it doesn't happen to everyone. This discharge could be white and lumpy, often described as resembling cottage cheese, or it could be more watery in nature. Interestingly, these symptoms can vary quite a bit. Some people may have symptoms that are mild and hardly noticeable, while others experience more severe discomfort, including redness and swelling in the affected areas. In less common cases, there could even be cracking in the vaginal skin. Moreover, certain activities might aggravate your symptoms. You may notice new vaginal pain or discomfort during urination or sexual intercourse. This could also be a sign that you're developing a vaginal yeast infection. If you experience any of these symptoms, it's important to reach out to a healthcare provider, as treatment options will vary depending on the cause. Now you might be wondering, what causes these infections, and are there any risk factors? Vaginal yeast infections are triggered by an overgrowth of Candida albicans, a type of fungus that normally coexists peacefully on your skin and inside your body. Many of us have small amounts of Candida in our lower intestinal tract, mouth and vagina, without experiencing any symptoms. However, a vaginal yeast infection occurs when this fungus grows disproportionately to the healthy bacteria in your vagina. A variety of factors can increase your risk of developing these infections. Pregnancy, diabetes, stress, and poor sleep patterns can all contribute. The use of certain medications, like antibiotics, hormonal birth control, and specific types of chemotherapy, can also be contributing factors. The use of scented tampons, douches, or certain contraceptive devices can also increase the risk. Having a weakened immune system due to conditions like HIV or treatments like chemotherapy and corticosteroids is another risk factor. Knowing the causes and risk factors can help you take steps to reduce your risk of infection. If you suspect you have a vaginal yeast infection, how is it diagnosed? This is a question that many of you may have on your mind. Well, the diagnosis process is quite straightforward and primarily involves a healthcare provider examining your symptoms. The first step in the diagnosis process is a conversation with your healthcare provider about your symptoms. They'll ask you about the nature of your discomfort, the specific symptoms you've been experiencing, and their duration. This discussion is a crucial part of the diagnosis, as it helps to narrow down the potential causes of your discomfort. Following this, a physical examination of your vulva and vagina will be conducted. This examination allows the healthcare provider to visually inspect the affected area for any signs of abnormality, such as redness, swelling, or cracking. For a more conclusive diagnosis, a sample of your vaginal discharge may be taken for testing. This sample will be examined under a microscope to detect the presence of yeast. This test is particularly useful in distinguishing a yeast infection from other similar conditions like bacterial vaginosis, certain sexually transmitted infections, and dermatitis. In some cases, if you have recurring infections or severe symptoms, your healthcare provider may recommend additional tests. These tests will help to identify the precise cause of your symptoms and ensure you receive the most effective treatment. The diagnosis process is vital because it not only confirms whether you have a yeast infection, but it also rules out other potential health concerns. It's important to remember that self-diagnosis can often lead to misdiagnosis and improper treatment. So, it's crucial to wait for a diagnosis from a healthcare provider before trying any treatments. Remember, while vaginal yeast infections are common and can cause discomfort, they are typically easy to diagnose and treat. If you have any symptoms, it's important to consult with a healthcare provider to get the proper diagnosis and treatment. This way, you can ensure that you're taking the right steps towards recovery and preventing